Hi, I hope everyone has had a chance to join us. Really excited to be here today. Good afternoon, and thanks for joining us. My name is Kayla Benjamin, and I write about the environment for the Washington Informer, which is a Black-owned local newspaper serving the DC area. And I'm glad to be here with our panelists today to provide some information about what I think is one of the most pressing public health issues facing our city. Just to give you a little bit of background, between 2001 and 2004, the district experienced one of the most severe lead and water crises in US history. And today, even though the most acute crisis of water treatment has mostly subsided, our city still has over 40,000 pipes with lead in them. And that's important for us to know because there's no such thing as a safe lead pipe. Lead exposure, even at relatively low levels, can have really serious health impacts. That's really especially true during pregnancy and early childhood. High levels of lead during pregnancy increases the risk of miscarriage and can cause babies to be born prematurely or at a low birth weight. Even very low levels of lead in children can cause behavior and learning problems. So it's important to know that there's no safe level of lead, especially for young kids. Luckily, there are some straightforward ways that we can keep our kids and families safe, and our panelists will discuss several of them today. I want to highlight one right now as a crucial way to protect children, which is making sure that they're screened for lead by a pediatrician, not once, but twice before the age of 2. I'm going to say it again, test for lead twice before the age of 2. And if we weren't on Zoom, I would make everyone here say it all with me because it's that important. Another way that we can keep our families safe from the health impacts of lead is to check if our homes have lead pipes. So DC Water hosts an online map that details all the pipe materials that it's recorded across the city. And you can look up your home the same way you'd look up an address on like Google Maps. It's not a perfect map, and there are a lot of pipes that are still marked as unknown, but it's a pretty good place to start. You can check the chat. We'll have a link to where you can find that on the DC Water site. You can also contact DC Water for other tests to find out if your pipes have lead. So that's my spiel, and our speakers today will give you more details on all of this, so I will turn the mic over to them. Our first speaker today is Dr. Sophia Teferi, and she'll set the stage for today's discussion by walking us through why this health topic is so important. Dr. Teferi is an attending hospitalist at MedStar Georgetown Hospital, and she received her medical degree from George Washington University School of Medicine and completed a pediatric residency at Virginia Commonwealth University. Dr. Teferi served as the medical director for the pediatric nurse forensic program, and later as the chief of pediatrics at St. Mary's Hospital in Richmond, Virginia. Dr. Teferi, I will turn the mic over to you.
Thank you so much, Kayla. I think if we can advance the slides. So I'm going to talk about the medical effects of lead. Are the slides? Oh, perfect. Thank you. All right. So childhood lead poisoning is the most common environmental disease in children younger than 6 years of age in the United States. And so we'll talk a little bit about who is at risk. Blood lead levels are the highest among children who live in cities with housing built before 1970. Children who live in lower socioeconomic class, African-American children are more at risk, children in foster care, and refugee children. And we'll go into more detail in some of this as the slides go on. And then among children who's at increased risk and why, children less than 6 years of age are especially vulnerable, but definitely even more so children who are less than 36 months. And the reason for this is because children's, the blood-brain barrier, which is the barrier in the brain that doesn't allow toxic things in, is not completely mature in young children. So it allows more lead to go into the brain. Children tend to have more incidence of iron deficiency, and that makes your lead exposure worse, or the effects of lead worse. And there's greater exposure to lead dust because of they breathe faster, they're crawling around, and they always have their hands in their mouth. So these behaviors along with some of their medical conditions, make children less than 36 months a lot more vulnerable than older children. Next slide. And so we'll go through some of the sources of lead, and I know there's folks who are going to talk a little bit more in depth about this, but from the medical perspective, children are exposed to environmental lead by inhaling it or by ingesting it. So they can ingest chips of paint or lead dust from lead painted surfaces, food or drinks served on lead glazed pottery, water from lead-based pipes, which we'll hear quite a bit about today, car emissions, and lead using industry. Next slide. Oh, next slide, yeah. I think you went backwards. We need to, next slide. Yeah, and then next slide after that. Okay. So lead levels in the United States, according to the Centers of Disease Control and the AAP, which is the governing body for pediatricians that set guidelines, as you already heard, there is no safe lead level, right? So this is very important to keep in mind. We do have parameters where we intervene and start to work with children and families, but there is actually no safe lead level. It should be 0. And in the US, we measure the lead level in the blood, and there's different ways to measure it versus just a finger prick versus getting a blood test. And as of 2021, the blood level in the US was decreased from 5 to 3.5 micrograms per deciliter, at which point we start to work with families and intervene. Next slide. So lead is directly absorbed into the body, and it's distributed into 3 compartments. And then some of it is actually excreted and gotten rid of by the body. And then so how much is absorbed really depends on how healthy the child is, because there's things that if the child is nutritionally not healthy would make the lead levels higher. And then children ingest the lead, they absorb the lead into their stomachs. And children are more at risk because they absorb about 70% of lead into their stomach versus adults only absorb 20%. And then when children inhale the lead, 30 to 50% of the lead is absorbed by their lungs. So these are really high numbers as compared to adults, and that's why children tend to be at more risk. So once lead is absorbed by breathing or ingesting, the lead is distributed into the blood, to the soft tissue, and to the bone. Children younger than 2 retain about half of the lead that they absorb. So again, very different than adults who actually only absorb about 1%. And then more than 70% of the lead in children is actually in their bones. So when we actually get blood levels, it's not a true reflection of all the lead that's in the body. It is what we're currently using to measure and decide whether we need to intervene. But the lead load is most likely a lot more than the blood level that you're seeing. So that's important to keep in mind. And then lead is actually retained in the blood for 28 to 36 days, 40 days in the soft tissue, and then greater than 25 in the bone. And the other important thing to remember is that when it's, there's different compartments that it's retained in the bone, and when the body's actually stressed, it excretes it into the blood. So even though the lead exposure has been removed, people can have continued high lead levels. So that's important also to keep in mind, that there needs to be continued monitoring of children who have high lead levels. So what are the short-term and long-term effects of lead exposure in children? Damage to the brain and nervous system, as we talked about, because their barriers are so immature and the lead can get into their brain much more easily than in adults. A lot of times they'll have slowed growth and development, and from damage to the brain, a lot of the children can have learning and behavioral problems, and then they can have hearing and speech problems as well. a little bit more in detail about the different systems that lead can affect. We talked about neurologically, behavior, hearing loss. In the blood, it can cause anemia, which is lower blood levels. As far as your hormones, it interacts very intricately with your vitamin D absorption, so you can have problems with vitamin D levels because of lead. In the kidney, they found that in adults, they actually get kidney injury and aren't unable to have good kidney function. In the stomach, which is a good chunk of the absorption, kids will come up with abdominal pain and constipation, and sometimes will present with vomiting. So testing children for lead, we heard a little bit about this already, but in 2021, the CDC lowered the population-based blood lead level from 5 to 3.5. That should say 3.5, actually, not 3. And the American Academy of Pediatrics, which sets guidelines for pediatricians on how to care for children, recommends screening for lead poisoning, that it needs to be assessed at 6, 9, 12, 18, and 24 months of age, and annually thereafter. And so the screening is a screening questionnaire. The blood lead levels should be checked if there's any risk detected. And according to the American Academy of Pediatrics, they recommend targeted screening or targeted testing rather to actually test the blood 12 to 24 months who live in communities with inadequate data of what the demographics are, or if there's greater than 25% of housing built before 1960. And then this is very relevant to DC because we have, I think, over 90% of our housing is built before 1978. And then greater than 5% of children 12 to 24 months of age with blood levels greater than 5. So because of these guidelines, if you go to the next slide, we'll talk about what is happening. Well, sorry, one more slide. Immigrants and refugees are especially vulnerable and need to be tested once they come into the country. And then for DC, because close to 90% of the DC housing was built before 1978, DC requires that all children have 2 tests by the age of 2, which you heard Kayla say. And in DC, they need to be tested at 6 to 14 months the first time, and then again at 22 to 26 months. So this is actual blood test. This is not a screening questionnaire. They actually need to be have a blood test to confirm that there's no lead in their blood. And lead test is required for children in DC to attend public school. So a little bit about treatment. It's a little bit complicated and comprehensive approach to treatment because of where the lead is and what numbers the child has. But it's really important to understand the child's environment and exploring where the lead is coming from. It's very important to assess the child's nutrition because that plays into how much the lead is going to be absorbed by the body. Assessing the child for iron deficiency, because again, that also will make the lead exposure worse. Other children in the family should be tested as well. Once a child has had one elevated level, they need to be repeated and very, very close follow-up. And then actual treatment, if the levels are above 45, is when they're admitted to the hospital for medication, and that requires specialty care. That is all I have, and I'll turn it back to Kayla, and we'll have the opportunity for questions later.
Great. Thank you so much, Dr. Teferi. Lots of information in that, and I'll remind everyone that if you think of a question as the presenters are speaking, we'll have a question and answer session later, but you're welcome to put it in the chat so that we remember to bring it up at the end. And now I will switch to, well, actually, we have someone else from the Green and Healthy Homes Initiative. Michael McKnight, the Senior Vice President of Policy and Innovation there, will be speaking to us. And just to give you a little bit of background, Green and Healthy Homes is a nonprofit organization dedicated to advancing racial and health equity through healthy housing. And Mr. McKnight heads up projects around the country, assisting with identifying funding sources and reimbursing for healthy homes and interventions, assisting with policy recommendations. He holds a degree in biomedical engineering from Harvard University. Take it away, Mr. McKnight.
Thank you. And our president and CEO, Ruth Ann Norton, yeah, she apologizes. Something came up last minute, but she's very happy to follow up on any of these items that I'll be covering. And we've done a lot of work there in DC and continue to do so. So I'm going to be giving kind of the overall kind of national kind of picture right now around lead pipe replacement. So starting with the problem, 12 million lead pipes around this country. It's estimated between 28 and $47 billion would be the cost to replace every lead service line in the country. We actually worked on a bill, the Environmental Justice Pollution Cleanup Act, that Senator Cory Booker introduced in 2021 that had a $45 billion figure to address all of the lead service lines in the country. So, a significant scale of the problem. But there's an expected high return on investment, so $3 to $4 for every dollar invested in addressing lead pipe replacement, and it is a significant source of lead exposure in the country. And the next slide will go into a little bit of that breakdown. Come back. Yeah. So overall, just in terms of like the cost of lead poisoning in general to our country, $43 billion annually. So, a lot of this comes from basically the economic impact of people that are lead poisoned. So in terms of there's a less likelihood that they graduate high school, get a college degree, more likelihood that they end up in, with the justice system and things like that. And so it's a costly problem, if we're thinking about $45 billion for the lead service line issue, but the cost to lead poisoning and reason why we have to address this, $43 billion, economic impact on our country. And lead paint has an even higher, return on investment than even lead and water. So at least a $17 return on every dollar invested for addressing the lead paint. So it's worth it to make these significant investments. And we see lead and water as part of the overall approach for all the sources of lead. So lead paint is responsible for about 70 to 75% of elevated blood lead in this country. And then you've got lead and water around 20%. And then that remaining like 5 to 10% is from other sources, soil, could be food, other sources. Next slide. So we've got this great historic opportunity, right now, with some of the bills that were just passed over the last couple of years. And so the White House, the Biden-Harris administration is, really looking to push to make these investments and to capitalize on these investments. If you heard the State of the Union address, this was called out as part of those remarks. So the White House has formed this Get the Lead Out partnership. You can go to like the White House website and kind of see that, but they're bringing together cities, counties, states, nonprofits, and all around. How can we facilitate and get lead service lines replaced as quickly as possible? How can we address lead and paint as quickly as possible? There's $15 billion in the bipartisan infrastructure law that was passed that can go towards lead service line replacement. So, essentially about a third of the entire full problem, but, this kind of investment we've never seen before. So we definitely want to sort of see that capitalized. The money is supposed to be used over 10 years. So starting in FY22, and then you see basically each, jurisdiction is getting part of that allocation. So DC is getting $28 million for FY22 towards the lead service line replacement. We do have this bullet around the accelerators. So spending this amount of money is not an easy task. And getting this money to help families. And so some states, some other jurisdictions have been sort of trying to develop essentially accelerators. These would be like entities to basically, can we get this money out the door? Can we get this money, there and replacing lead service lines, making families healthier and safer. And so, jurisdictions around the country are, trying to figure out how do we really capitalize on all this federal investment that's coming down right now. And it is part of kind of the overall broad national plan that we have, to address the water sources as well as the paid sources. Next slide. So here you see, as I said, it's a 10-year sort of investment, this $15 billion. So there's, 1.9 billion in that first year being provided from the infrastructure bill. So kind of trying to get things started. But on top of the money from the bipartisan infrastructure law, there was also the American Rescue Plan Act. So this was kind of the pandemic related economic recovery bill, and that is getting deployed through the U.S. Department of Treasury. And then there's a portion of the of ARPA that is going directly to jurisdictions and states. This $350 billion, and Treasury specified that addressing lead hazards was an eligible use of funds. So many jurisdictions around the country have actually utilized some of their allocation of ARPA funds to address lead. And so $345 million around the country. And then here in DC, we've got $30 million of ARPA funds that have been allocated to support the lead service line replacement program here in DC. Next slide. Now, there's been a couple kind of, issues that people are very, top of mind. And, one of them is equity, right? How are we going to make sure that these investments get to the communities that are most in need of them? And so I'll start on the right side of this slide. This is an example from Newark, New Jersey, where they wanted to address the issue of people in rental housing, right? So if you're in rental housing, you essentially have to wait for that rental property owner to agree to, be part of a program to address the lead service lines. And so, Newark passed an ordinance essentially requiring owners of properties to replace lead service lines, and we're able to get 24,000 lead service lines replaced, in only a couple years. And so, that was a way to try to address the kind of rental versus homeowner, equity issue. Also, just in terms of like, how do we cover the portion of lead service line replacement that is basically going to be private investment matched up with public investment? And I think that the next speaker is going to really kind of go into those issues here in DC. But that's, a major barrier is, on the private side, who is going to pay for these lead service line replacements. And then just another example of legislation from Maryland that we worked on, where we essentially worked with this Maryland state legislature to pass this Conservation Finance Act that, one, helps like identify where lead service lines are for schools, for families, for businesses, and then also to provide more support and basically direction so that this investment is going to disadvantaged communities and not to sort of the folks that maybe can pay for the private section of a lead service line replacement on their own. So I'll pass it back to Kayla.
That's me. Thanks so much, Mr. McKnight. That was great. And it was good to get an overview of what's going on at the federal level. And now we will hear from Paul Schwartz from Lead Emergency Action for the District. And he will talk more about the problem of lead and water in DC and in our homes. Paul Schwartz is an organizer, both for Lead Emergency Action for the District and for the Campaign for Lead-Free Water. He's a former National Water Policy Coordinator for Clean Water Action, which is a federal group. He has helped to plan and implement the Campaign for Lead Exposure Reduction and Childhood Asthma in the District of Columbia. and he served on the DC Lead Service Line Replacement Planning Task Force, which prepared a report last year evaluating and making recommendations for DC Water's plans to replace all lead service lines in the district by 2030. Paul, take it away.
Thank you, Kayla. And I especially want to thank the organizations that helped put this together, in particular, the Climate Justice and Environment Committee of the local DC branch of the NAACP, AAP, and the DC Health Benefits Exchange, and many others, GHHI, Green and Healthy Housing Initiative, who you just heard from. And to thank Kayla. I've been working on lead and water in our town for over 20 years. And I just want to say that DC has had the most widespread lead and water crisis in the nation. From 2001 to 2004, we had around 30 times more lead coming out of our taps than in Flint, Michigan. And we had a couple of spikes of fetal deaths, and possibly up to 42,000 of our kids between 0 and 6 got elevated blood leads from lead water at the tap. So lead is in almost every building in the in DC, either from a 100% lead pipe known as a service line. We'll talk about that a little later. And also from the plumbing and the pipes and the fixtures and the faucets in our homes that have lead in them. And I'll get back into that in a little more detail. But DC's crisis led the nation in terms of the duration of it, the lead levels in the water, and the documented health harm, and was the highest recorded in modern US history. Go to the next slide. Of course, one of the major focuses that you've heard about is the service lines. I just wanted to show you what a service line looks like. So you have the house on the bottom of the screen, and then you have a pipe going from the house to the middle of the road. That pipe going from the house in the middle of the road is called the service line. It can be lead or it can be other materials. Other problematic materials include galvanized pipe and brass pipe. And then that pipe along the top of the page is the small drinking water main that connects to the big pipes that go back to the reservoirs and the plant on the Potomac River that pulls in our water. Just so you have a visual picture of that and know what one of the things we're talking about. And go to the next slide. Another big and important source is the technical term is premise plumbing, but it's all the pipes and the faucets and the fixtures and the solder and the flux that join those fixtures. They have lots of lead, and you can go to any hardware store and buy those fixtures and those faucets, and they have on the box lead-free, but by legal definition, there's still lead in the lead-free plumbing fixtures. And next slide. Yeah, and you've heard from Dr. Tafiri and others that lead and water mixes with the formula that we want to reconstitute, the food that we feed our babies with and cook with, so your mac and cheese, and the water that we drink. You can't get lead from water from showering, so you should know that, and we'll talk about that a little later. The major message, and we're going to be repeating this a number of times, is until we get all the lead out of our house and out of the pipes, get a filter. Next slide, thanks. And I'm going to talk a little bit about some important information about filtration. So you want to buy either a faucet mounted filter, or to the right, the picture is a countertop pitcher style filter. But it's really important to buy a filter that is certified by the National Sanitation Foundation, or NSF, for the standards numbers 42 and 53, which get out all what's called soluble or dissolved lead, which we'll talk about a little bit, and lead particles. And get help to make sure that you've installed it properly and that you use and maintain it properly according to the manufacturer's instructions, because if you don't, things will start to fall apart. Use only cold water through the filter. Don't ever run hot water through it, because that can both ruin the filter and it could lead to harmful viral or bacterial growth. So you don't want to solve one problem and create another. And can we go to the next slide? Thanks. I think we missed some slides. Or they're out of order. Go down one and then go back, keep going. Nope, we're missing some slides. Okay. So I'll just talk about a few things. One is that there's, I'm a little thrown, but I will come back. There's two types of lead and water. One is soluble or dissolved lead, and that's soluble and dissolved lead is like when you put sugar in your coffee or in your tea, that goes away. And then there's lead particles, and lead particles are when they come off the inside of the pipes, either outside our homes or in our homes, they can have up to industrial levels of lead exposure. So lead in the hundreds or thousands of parts per billion. And that lead is very hard, the way we've designed our testing for water, to pick up. And so it's mostly missed. And it also comes off the pipes and our interior plumbing very erratically. So if you're trying to figure out how much lead is coming through your tap in your kitchen or elsewhere, it's really difficult to do that with the type of testing that we have available for the home, because the amount that you get at any one time could be different in the next hour or the next day. And you could go from non-detect for lead to lead in the tens, hundreds, or thousands of parts per billion the next time that you check it. What we should be assuming is that if you have a service line that has lead, or if you have a home that meets the, that's older, let's say before 1986, that you're very likely, according to DC Water's own data, to have some amount of lead coming out of your tap at some point. I really want to let people know that it's really important to understand that while lead paint and other sources of lead that Dr. Teferi highlighted are major sources of lead in our homes and in our communities, lead in water can be both a contributing cause, but it also can be a primary cause of lead in water and lead in blood, and it can be the sole cause of lead in water and lead in blood. And when we do blood lead testing, one of the things that is good to know is, as Dr. Teferi said, lead in water only stays in the blood from 28 to 36 days. So if you get a particle of lead that falls off of the pipe randomly and erratically with hundreds or thousands of parts per billion, and you don't test within 28 to 36 days of the exposure, that gets missed. And the blood leads, of course, will miss fetuses that are in development and children before their first blood lead testing. So while it's really important, and we recommend doing that 2 by 2, we can't rely, as Dr. Teferi said, on knowing all of the exposures and the extent of exposures from blood lead testing. In fact, the way the blood lead tests are designed, they don't get a lot of that result. And if you there are a number of common questions about lead and water in DC. I'm just going to talk about a couple of them that I hope we can expand in our conversation later on. But I wanted to give everybody a link to the peer-reviewed science papers if you want to dig deeper that inform our understanding of lead and water and testing and the policies that come out of that. And I want to answer the question, so how do I know if my water is lead safe for drinking and cooking and mixing with formula? And on the showering part, you don't have to worry because at least for lead in water, it's not a big issue. For other chemicals and biological contaminants, showering can be a source that is problematic, but not for lead. And so the most important thing to know is to assume, even without a test, that you're going to have to protect yourself from lead and water from your tap and to use a filter as we've talked about. And then one of the things, the last question I want to answer before I turn it over is when the water utility or the media or others say that our water meets all the federal and state standards under the lead and copper rule, does that mean that our water is safe to drink? Unfortunately, meeting all of the federal and state standards of something called the lead and copper rule, which is the federal law under the Safe Drinking Water Act that regulates our water utilities, isn't sufficient to know that your water is safe to drink. It's a very weak standard. It was just weakened. And we're talking about with US EPA, and we'd like your help about issuing a new rule that's more health protective and just. And if you want to get a sense of the actual data from DC Water, from their what's called their compliance sampling and from voluntary sampling, you can look and connect to this blog, which shows the difference between meeting the regulatory standards, which DC does, and whether the water is healthy and safe for drinking. And so with that, I'll turn it back to Kayla. Thank you so much. Look forward to the questions and answers and in the chat.
Thanks again, Mr. Schwartz. And I'll just repeat again that if you have any questions, please feel free to put them in the chat. Catherine and Colette, I see your questions and I have them written for when we get to the end. Next up, we have Randy Speck, who also served as a public representative appointed by the DC Council to the Lead Service Line Replacement Planning Task Force. He's a member of DC Water's Stakeholder Alliance, which is a group of residents who have provided informal input to DC Water's general manager. And he served for 10 years as the Advisory Neighborhood Commissioner for ANC 34G3 in Chevy Chase. Randy, thanks so much.
Thank you, Kayla. I'm glad to be here today. I really appreciate the comments that Sophia and Michael and Paul have made. They sort of introduced the problem. What I'm going to focus on now is what we're doing in DC to try to address this problem. And as they've indicated, it's really a very substantial problem that must be addressed quickly in order to keep our people safe. So first I talk about 4 or 5 questions that are raised as a result of the problem that's been created. First, how big is this problem? Is it a big problem throughout the city? Is it located in particular areas of the city? Then I'll talk about how DC Water has tried to do this in the past. I'll treat that only very briefly because Paul has covered a lot of it already. And what does DC Water propose now to remove lead pipes? What's their plan? Then we'll talk about some proposals to improve their plan, including some legislation that's being considered right now. And finally, what you can do to help get the lead pipes replaced. Next slide, please. First of all, there's been some discussion, and Kayla mentioned it at the very beginning, about the inventory that DC Water has prepared. I suggest that you don't rely on DC Water's inventory. In fact, there are a lot of mistakes in it. There are indications sometimes that you've got copper pipes, and in fact, they're lead, or they're galvanized, or they're brass. And also, there are a lot of pipes out there that just haven't been adequately inventoried at all. So what are the estimates of the number of lead pipes in the district? That varies enormously. There are about 21,000 pipes that we believe are lead, that DC Water has identified as lead. There's another 15,000 or so that are unknown. They don't even know what the material is. But DC Water has also indicated that there are a lot of pipes that are identified as having copper service lines, but in fact, they may be lead or galvanized or brass. And they estimate that there are about 48,000 of those. So there's going to have to actually find out whether there's lead pipe in your service line. So how do you determine whether you have lead pipes? Paul talked a little bit about the testing procedures where you take a sample from your water to determine whether there is lead in the water. That's not a reliable indication of whether you have lead pipes. The only way you can determine positively that you have lead pipes, if in fact you do take a sample and it shows that there's lead, that's definitive information that there is a lead pipe there. But a negative test will not really tell you anything. You have to actually look at the pipe. So what is DC Water doing to identify lead pipes? They're having to go out and do test pits at each location. And they're going to be just thousands and thousands of those test pits that will have to be dug to actually go down and look at the pipe. There are some new techniques that are being tested right now where they could actually go in and look at the pipe remotely, but those are not yet reliable enough to be used in the district. And we are recommending that DC Water actually go out and look at the pipes to determine whether they're lead. Next slide, please. So what does DC Water propose to do to remove the lead pipes? As Michael indicated, there is a good substantial amount of federal money that is now available. And we need to certainly take advantage of that federal money to make sure that we use it effectively to get rid of the lead service lines throughout the district. And the plan is to do that by 2030. And DC Water has committed to do that at no cost to customers. That is going to be a little difficult to implement just on the basis of the federal subsidies that are being provided. As Michael indicated, to take care of all of the lead service lines throughout the country, it was going to be about $45 billion. And they only have funded about $15 billion. And so there's going to be a shortfall, and not all of these lead pipes can be replaced using only the federal money. But DC Water has committed that it will replace all of the lead service lines by 2030 at no cost to customers. That means, however, that the costs are going to be passed on in rates. So somebody is going to have to pay for it, and it's going to have to be DC Water customers. So it's very important that we do this as efficiently as possible to make sure those costs are as low as possible. So DC Water has planned to improve the efficiency by going block by block rather than doing it on a piecemeal basis, scattering their resources all over the city. So hopefully they're going to be able to do this on a block by block basis. Just start on one end of the block and go to the other end and make sure that they take out every lead service line along the way. DC Water is proposing criteria to prioritize those blocks. Some of the considerations that they're taking into account are equity, as Michael mentioned before. Another consideration is where the concentrations are of lead service lines. And then finally, they want to make sure that they replace any lead service lines when they go to replace a small diameter service main line. That's the line that Paul was describing that runs through the middle of the street. If they're going to replace those, they want to make sure they replace all of the lead service lines in that block as well. Next slide, please. So our task force recommended a number of changes to the program that DC Water had proposed. Some of them were to make it more efficient, particularly with regard to permitting and getting those permits lined up in advance so that they can do it very efficiently. But also we made some recommendations to make it more equitable so that the households that need the replacement of the lead service lines most will be scheduled at the beginning. The DC Council is now drafting some legislation that will require lead pipe removal by 2030. And that legislation is based in part on the success in Newark, where they required landlords, particularly, to allow the replacement of the lead service line. And that has sped up the process considerably. But finally, and this is going to be included, I think, in the legislation that's set to be introduced within the next few weeks. Filters will be provided to all customers at no cost. And that's a very important, as Paul has emphasized in his discussion, filters are essential. Next slide, please. So what can you do to help get your lead pipes replaced? Voluntary replacement is still available, but it would be at a customer's expense. For instance, if you're way down the list and you're not going to get your lead service line replaced until 2025 or 2026 or even later, you may want to accelerate that process and get your line replaced sooner. You can do that, but it will be at your own expense, and that's usually a cost of about $5,000 to $6,000. So if you don't want to wait and use a filter for the next 5 or 6 years, you can replace it yourself. You can ask DC Water when the lead pipes in your block will be scheduled for replacement, and you can use their email address, lead, L-E-A-D, at dcwater.com, and just write them and ask when your block would be scheduled for replacement. You can also spread the word to your neighbors and friends. Make sure they understand this process that we're going to be going through. We need cooperation from everyone in the community. This will go a lot more efficiently and at a lower cost if we can get neighbors, all the residents in your block, all the neighbors in your area to cooperate to help DC Water to make this program work. And finally, as we've emphasized several times, use filters until lead pipes are replaced. Next slide, please. And here are a few resources that you can check out if you want to look at this in more depth. First is the Lead Service Line Planning Task Force report, and that's from November of last year. And that's about a 30 or 40 page report that will give you a lot more information. And there's also another report that was done for the council in September on the costs. And finally, you can contact Paul Schwartz or William Washburn if you have any further questions. Thank you, Kayla.
Great. Thanks so much, Randy. I just want to point out here, we have a few extra resources. If you're looking for more information, we will be providing this presentation afterward. It will be available at aapdc.org, as well as probably on our other partners' websites, including dchealthyhousingcollaborative.org and the website for the Green Healthy Housing Initiative. So if you're looking for more information, you're also welcome to contact any of our partners. The resources we have here include contact information for them. If you have any questions that you want to follow up on, everybody here would love to answer your questions. So now we will move on to the Q&A part, which is of course the part that I was most excited about. And we'll start with, oh, Catherine says your question was answered in the slides. Beautiful. Glad to see it. So we'll move on to Colette's question, which I'll throw to you, Randy, which is, for those of us who are renters in DC, what rights do we have in regard to the possible impact of lead paint or pipes in the homes we live in? For example, if we were to take a blood test for lead levels and it was high, is that something that can be pursued legally?
Well, that's a good question. I'm not sure whether there are any I'm sure that there would be some legal recourse against the landlord if the landlord is aware of the situation and hasn't done anything to change it. With regard to DC Water, the best bet is to get your landlord to cooperate with DC Water to have the lead service line removed as quickly as possible. The new legislation that's being contemplated right now will address this issue of landlord responsibility versus the renter's responsibility. And hopefully it will make it more, increase the obligation on the landlord to correct the problem.
Okay, Paul answered this in the chat, but I will throw it to you to answer out loud as well. We have a question from Lori asking, are galvanized pipes that are once they're attached to short lead pipes and goosenecks or pigtails, please explain what those terms mean, are they considered lead service lines?
Well, it's a really good question from Lori, who I actually work with out in Portland, Oregon, because they don't have what we might think of as lead service lines in Portland, Oregon, but they are they're above what the EPA considers the right amount of lead in the drinking water system wide. They're one of the communities without lead service lines, but are above the health action levels. And that's because both in Portland writ large and in DC, there's a number of pipes that are shorter. They're known as goosenecks or pigtails. And as was mentioned both by Randy and Michael and others, in addition to the 100% lead service lines, there's galvanized pipes and brass pipes. And one of the things about galvanized pipes is that they'll accumulate lead that's out there and sort of store it up and then send it in spurts back into the buildings, including residences and daycares and libraries and rec centers and other places. So it's really important in the definition of what is a lead pipe to include all of those things, both here in DC and around the country. And so some of these issues haven't been all settled, and that's why this legislation that Randy talked about that's going through the DC Council, we hope, but it's going to be introduced shortly, plugs some of the holes in the, and make sure that our program here in DC is completely health protective of the public. I just want to add one thing again, that having your lead service line replaced is really, really important, but also the more difficult part of working on getting rid of the lead inside the house is necessary. And so to turn it back to Kayla.
Okay, I'm not seeing any more questions in the chat, so I'll throw one of my own out there before we wrap up. And I was curious, what are schools doing about this, or daycares, libraries, rec centers? Do we have a lead water problem in those public spaces? And I'll throw that to you, Paul.
Yeah, so starting in the late 2000s and up to this moment, we've had identified in different waves of testing real exposure problems with lead in our drinking water in schools. And there's actually a law in DC in 2017 that addresses this issue, and it requires filters in the schools to be used. And that's really good because it breaks from what US EPA says, which we think is not health protective, to find where the lead is and then fixes it. And it's also very expensive. And it says what we need to do is to put a barrier between that lead and the people in the schools, staff and school children and others from drinking it. It's not a perfect bill, and we have work to do. There's a lot of parents of school-age children who are involved in tracking this, and we'd be happy to connect folks to those people. You saw what Dr. Teferi said about children and their absorption rates and how they're not just little adults. And so this population of kids whose brains haven't fully filled in until they're 23 to 26 years old, and they're a really important population. Some of the big societal problems we're having in the city, the school to prison pipeline, the lack of graduation rates, homicide and violence, in the peer-reviewed literature are tied, at least in part, back to the amount of lead in general, and also to lead and water in particular. And so there's individual harm that we've been talking about, but there's also big community harm that's happening from these exposures across our city.
Awesome. We got one more question in here from the audience. I know we're getting close to our end time, but I'll throw it out there to whoever wants to answer, which is, what is the percentage of children under the age of 6 being tested twice for lead before the age of 2? Does DC Water encourage their clients to have their children tested for lead, and what is being done to encourage more testing?
This is Mike from JCHI. I don't know like the specific percentage right now in DC, but I will say what we've seen like nationally is that even though just in like Medicaid, for instance, it's a requirement every child on Medicaid gets tested, but when you look at the rates like nationally, it's under 60%. So there's a lot of work that needs to be done in order to get to full testing, and the pandemic has only decreased the rates or whatever. So the last few years, we've seen like the rates that were there before the pandemic drop by half or so. So there's lots of there's a concerted effort right now that HHS nationally and lots of health departments around the country are really focused on how do we now get these test rates back better. But it really takes a lot of partnership from providers, from health plans, from health departments. So not just DC Water, which yeah, that is a great opportunity if DC Water is working with the family to say, do you have children tested? But there's lots of different sort of vantage points by which to keep advocating, but it's something that is a huge problem that we need to really focus on, is getting as many people tested as possible.
Okay, thank you. And thanks to everyone who joined us today. Also, huge thanks to our partner organizations for putting this together, including the DC chapter of the American Association of Pediatrics, the Campaign to Reduce Lead Exposure and Childhood Asthma, and DC HealthLink. Once again, you will have access to this presentation on the aapdc.org site, as well as some of the website for some of the other partner organizations we've heard from today. And this presentation includes contact information for the experts that we heard from. So if you have more questions, please feel free to reach out. We really appreciate you sharing your time with us this afternoon, and have a good rest of your Thursday.